Hi everyone, welcome to the Addiction Recovery Channel. I'm Ed Baker and I'm your host. Today we have the great privilege of interviewing State's Attorney George. Thank you, Sarah, for being here with us.
As always, thank you for having me.
Sarah has been the State's Attorney in Chittenden County since 2017. She had served with our Attorney General T.J. Donovan from 2011 to 2017. Sarah is now running for a third election.
That's right.
Thank you for your service.
Thank you. Thank you very much.
Sarah is running against Bram Kronigfeld, who was invited to participate in a friendly debate here, but declined through his campaign manager. So I've decided to just have Sarah on and talk about some of the issues facing Vermont and specifically Chittenden County.
Yes.
So I guess I'd like to start with, I read your platform, and your first item is building a fair justice system in Chittenden County. And one of the things that caught my eye, because of my interests, is that justice is not criminalizing poverty, addiction, or mental health challenges. And I'd like you to elaborate. What do you mean by that?
What I mean by that is that historically our criminal legal system has frankly been designed to police incarcerate people who have mental health and substance use issues and people who live in poverty in general. And the way that it's done that is by criminalizing behaviors that come with those things and by imposing policies and laws that make it difficult for them to escape those things. Mm-hmm. And so I run my office and develop and implement policies that try to strip some of that away from our justice system and instead focus on what actually keeps us all safer, which is to address those underlying causes, to address those basic needs that people have, to connect them to services and make them better members of our community. And that is what makes us safer. That is what, from my perspective, a fair justice system requires.
All right. It's kind of funny. I'm going to date myself. The band, back in, I think it was a long time ago, they wrote a song called The Shape I'm In, and I copied down the lyrics because I think they apply. I've just spent 60 days in the jailhouse for the crime of having no dough. Now here I am back on the street for the crime of having nowhere to go. And that applies today.
Yeah, that's powerful. It does apply today. There are a third, I think, of our state's incarcerated population is being held on cash bail that they can't post. Many of them, the cash bail amount that they can't post is less than $500. So it is very much still happening, and it primarily targets poor people and unhoused people.
Well, let's talk about that a little bit, because I think that kind of dovetails into this other platform plank that you hold, that you will not bend to federal influence. And part of the federal influence at this point really is to criminalize people who use drugs, criminalize people who deal with poverty, criminalize people who deal with being unsheltered or homelessness. You have ICE coming in and frightening communities and frightening upstanding citizens that may be in jeopardy of being deported. Well, what are your stands on these issues? Because they're so important and they're so current and so meaningful to our neighbors.
Yeah, I think that what we have seen in our federal administration is an almost immediate walk back of a ton of the progress we had made in the criminal justice reform world. policies that have been implemented by the Obama administration and then the Biden administration that just have been decimated under our current administration, and decimated intentionally to other members of our community that are not of this sort of racial or class order that our current administration is attempting to prioritize. And it's working. It's trickling down into states around our country, states that are following suit to overly, like, kind of go back decades and overly police and prosecute people of color, people with mental health issues, undocumented folks. It's a terrifying time to sort of be trying to fight against those very things. And we've seen this before around the world. We've seen this type of government happen before, and we are watching it happen again and seemingly struggling to keep up and to fight back.
Yeah, and thank you for your part in this ongoing struggle. It seems timeless to me. There's two programs that I know you're involved in that I think are a pushback. One is specialized diversion programs, and the other is accountability court.
Yeah.
And can you talk a little bit about that? That there is there are pockets of justice where people who are traditionally discriminated against, disenfranchised, and otherwise, persecuted, are actually being protected and helped and kind of directed in ways that will, improve their likelihood of succeeding in the future. Can you talk about that?
Yeah. So the first program I applied for and received a grant from a national organization under the promise of developing and implementing an innovative diversion program. And so I partnered with the folks at VCGR in Burlington who do a lot of incredible direct service work, and primarily with a lot of the people who have, sort of burned a lot of other bridges with other social services or care providers. And the idea was to take individuals in our courthouse who were struggling to show up for court, who were struggling in the community, who were unhoused, who were dealing with some pretty significant substance use issues, and essentially send those cases and those people to VCGR, which had the trust of these individuals, had relationships with these individuals, who these individuals were not afraid to show up there as they were afraid to show up at court, who had a lot of flexibility in when they arrived, all of the things that our court system doesn't allow for. And a harm reduction approach, that the request was not necessarily that you stop using drugs, but that you engage with them to use less or to eventually not use at all, and that they not continue to commit new offenses. And if they did those things and they showed up every week, they would be paid to come. VCGR, through this grant funding that was paying for this, would pay them to come and would also help them connect to housing and residential or contingency management, what other services they needed. And if they did that, their cases were dismissed. And we were able to clear over 300 cases through that program. It's still ongoing. We still have some money left. But on top of that, we then built the accountability court, initially through the help of the governor's office, and now we're doing it on our own, to prioritize people in our community who have multiple pending cases and, again, are struggling with homelessness and mental health or substance use issues. The beauty of the way that our accountability court is set up now is that we hear these cases every Friday. So an individual is not getting a court date months out and then expected to remember it. Yeah. All they have to remember is I have to be in court every single Friday. Yeah. And when they show up, there is a caseworker from Howard Center in the courtroom to meet with them, to engage them in services, to try to get them housed, all of the sort of magic that caseworkers can pull that people who are struggling have no ability to navigate. It's impossible. Our systems are designed, frankly, to keep people down. But when you have a caseworker and the caseworker who wants them all to succeed, really incredible things happen. And what we've seen is that people show up because the court date is a manageable time. They show up because they're being benefited for coming. They're being connected to services, and they're engaging with those services. And because of all three of those things, they're not committing new crimes. And if they are, or if they do, which has happened a couple of times, we know about it immediately and can address the behavior immediately with the court. It's the same prosecutor every week, it's me. It's the same judge every week, Judge Kadams. It's the same courtroom every week, and it's the same caseworker every week. So that consistency is building relationships with these people and accountability for these people in a way that we were not previously doing. And it's been very successful.
Yeah, and you can easily see why it's successful.
Absolutely.
Because you're using I'm sorry.
I was just saying, we also, I try to have food available and snacks available and, bananas available for people to just make sure that they know that, if they come, they will be held accountable, but what we're doing to make sure that that happens is connecting them with services and meeting their basic needs.
Right, it's like services based on science and compassion.
Right.
With the respect for dignity, is a whole world away from punitive measures and pure punishment, just for punishment's sake.
Yeah, and it doesn't work. I mean, we have 200 years of evidence that punishment for punishment's sake does not work.
Yeah.
It actually makes us all less safe. Recidivism for incarcerative sentences is high, and people who go into jail on nonviolent offenses are more likely to commit violence when they're released because of the exposure to violence when they're incarcerated. And it's not economically feasible. We spend $300 a day to incarcerate somebody. That's more than a night at Hotel Vermont.
Yeah, I can remember back when we established the North Central Vermont Recovery Center in Morrisville.
Yeah.
The overall funding for a year was $50,000, and it was exactly the amount of money that it cost to incarcerate one person for a year in Vermont. That same $50,000 could fund a recovery center for 1 year. This brings me hope because, what I hear you talking about are services based on really understanding the person and the challenges facing the person, rather than this, we're going to punish you and then you'll learn from that and won't do that again, which is just, it's so shallow.
Yeah.
But I think there's another example where your office truly understood people with addiction. It's when people with addiction were at threat to be arrested and charged with a crime for the possession of small amounts of buprenorphine. Can you talk a little bit about that? What went into your thinking to actually change that law in Vermont?
Yeah. When I first became state's attorney, I was seeing all of the folks who were dying from fatal overdoses, and so I convened a group of experts in harm reduction and substance use disorder and law enforcement. I had them basically tell me, what can we be doing better? We're failing our community when we have this many people dying every year from overdoses. And I believe it was initially Tom Dalton from BCGR who said, you need to flood our community with buprenorphine. It's hard to get, and it saves people's lives. And we need to make it easier to get, easier to possess, and easier to use. And if we do that, people will not die.
Yeah.
And that was powerful to me because it seemed like such a simple, tangible thing that we could work on. And so we brought the UVM Medical Center into the conversation. We brought the mayor's office into the conversation, and again, law enforcement, Burlington law enforcement in particular. And we made it happen. I mean, we got the emergency department to start giving it to people if they presented at the ER that needed it. We had, Dr. Blake started prescribing it to people in the community. I believe went through the additional training needed for that. And we sent a really strong message to the community that if you have the choice between fentanyl, or at the time heroin, or buprenorphine, which was illegal to possess without a prescription, take the buprenorphine and you will not be arrested, you will not be charged. And that year we saw our overdose fatalities drop by over 50%. And there was outrage by some people that, we were allowing someone to possess a drug without a prescription, which I think frankly just comes from this idea that laws are never supposed to change, that you're never supposed to adapt, that you're never supposed to learn from mistakes. And I was grateful for Burlington Police Department's partnership in that, because I think that having the police on board is really what made such a big difference.
Yeah, I think it's one of the things that makes Burlington special.
Yeah.
That we have a group of leaders that have minds that are open and to science. There's a lot of addiction science that's taken place over the past 50 years. We know a lot about it. We know about a lot about people with addiction and how they operate and what makes them do the things they do. So we need to intervene on that level, on that real level, and that's a shining example of it. And you mentioned the overdose fatality rate dropping. Also, I think you were here. I know you were here when the Good Samaritan laws came into existence. You were here when naloxone or Narcan, naloxone, became widely available to our addicted population, and we do see the overdose fatality numbers dropping, and in Burlington, especially in Chittenden County. What was it for 2025? There were tragically, and I always want to underline the tragically, 27 overdose fatalities. Is that correct?
That sounds right. Yeah.
And that was, I think, there's been a fairly precipitous drop from 2023 through 2025, and hopefully it will continue. So, congratulations to everyone who's been working really hard to make that happen.
Yeah, and I think it's telling that that's happening when our drug supplies are getting more and more dangerous.
They are.
The introduction of fentanyl was just absolutely devastating to the work that we were doing, and so we've kind of adjusted and figured out other ways, and I think you just constantly have to adjust as the data and research presents to you. I think that that's our obligation as elected leaders, and I don't think that stops with prosecutors.
I'm glad you mentioned that, because, I was here and you were here when heroin was here.
Yeah.
And we all, heroin was a problem.
Yeah.
And good Lord, we never even could begin to imagine what heroin would morph into.
Yeah.
And a lot of that occurred, the Sackler family saturated America with illicit, very powerful opioids became available very, very easily. The population of people addicted to opioids grew. The cartels came in and capitalized on that with cheap, high-grade heroin, and now we have fentanyl. So we have a massive problem that exists that we have to deal with, and it's not through punishment, and it's not through incarceration. So I know one of the current ideas that's taking hold in Burlington is the idea of an overdose prevention center. It's been funded by the Opioid Settlement Advisory Committee, not by Sackler money, pharmaceutical money, not taxpayer money. It's been mandated by the state legislature. It's law. The guidelines have been developed by the Department of Health, and they're being carried through by the city government and VCJR, and it's about to happen. I know that you have been a proponent since 2016, is it?
Yeah, 2017. It was one of the first things I announced as state's attorney.
Yeah, talk a little bit about that.
Yeah, so the same group of folks that brought the Suboxone idea to me, one of the tasks I gave them was that I had heard about these things called safe consumption spaces, and that I was intrigued by the idea, and I wanted them to convince me one way or the other whether this was something that I should advocate for as a prosecutor. And I will tell you, I went into it skeptical. For all of the reasons I think a lot of people are skeptical. I wondered if it would encourage drug use or like impact crime rates, all of those things. And they wrote a, I think, 21-page report for me by the end, and the overwhelming opinion, and based on the overwhelming evidence, was that they work to keep people alive, and they also work to connect people with services that they are not otherwise receiving when they are using in the streets or in houses by themselves or in alleys or wherever else they might be using. The thing that stuck with me is this talk about like people that were against safe consumption spaces not recognizing how many unsafe consumption spaces we currently had in our community, and in fact those people being outraged by the unsafe consumption that was happening in the community. So one of my first announcements as state's attorney was that I supported them. I found out kind of at the same time that then Representative Selena Colburn actually had a bill to start this conversation, and so it was a good segue for me to support that bill and to be really vocal about it. And I think because of my position and how unusual it was to have a prosecutor advocating for something like that, it got a lot of attention, it got a lot of conversation, both good and bad, and it took years to get here, as most things do through the legislature, but we are there. And I think that, again, when people are seeing drug use in the community and are coming to me with their concerns about that, my response is always, well, what are you doing to support the opening of an overdose prevention site? Because that's what that's for, and that's what we need. And that is the answer, not that these people should be in jail. Because I want to make sure it's very clear that people can use drugs in jail, and they are using drugs in jail. I talk to people all the time that have said that it is just as easy to get drugs in jail as it is in the community. So this idea that at least they're not using is actually not true.
And then the overdose death rate for people who are leaving the correctional system is the highest death rate of all. I want to commend you for your courage as a public leader, for taking a public stand on this because it's so controversial, and commend you for your efforts to decrease stigma and increase compassion regarding this population and this specific idea of an overdose prevention center, because there are some leaders that are remiss in that. They have the public eye, they have the forum, they have the attention, and they're not taking the opportunity to educate the public. And I want to commend you for that.
I think that being, my job is public safety. My goal is public safety, and I think historically that has been seen as one very clear thing. And any time that you're changing the narrative to actually educate people about what true public safety means, which is connecting people to services, keeping people alive, and making sure that they're better people in our communities, it comes with a lot of pushback. But eventually, if you have a lot of conversations with people and explain the data and research to them, I tend to think that most reasonable minds come around.
And the data and research is now available for these types of overdose prevention centers in America, in Rhode Island and in New York. It's not just Europe anymore. It's happening right here in our country, and the data is overwhelmingly positive. I want to move into another segment with you, is that there is violent crime. There has been a surge of violent crime in healthcare settings. There's domestic violence. There's violent crime on the street. What are your policies toward violent crime and people who commit violent crimes?
So in 2020 in particular, when COVID hit, and then actually I should say in 2022 in particular, when we're sort of starting to come out of COVID, that was one of the most violent years in Vermont history. Vermont's homicide rates skyrocketed, not just in Chittenden County. Gunfire incidents went up significantly all over the state, but including Chittenden County. And from from that moment when all of these, when this increase in violence was happening, at the same time violence was increasing in healthcare environments, and that again was all over the country. My brother and my sister-in-law are nurses at Dartmouth-Hitchcock. It was happening there. It was happening in other hospitals in Vermont. So the things I did, first, our laws do allow prosecutors to ask that somebody be held without bail if they are suspected of committing a violent crime. The evidence of guilt of that crime is great, which means we have to put on evidence to show the judge that the evidence of guilt is great before they'll hold them, and that the risk to the community if they are released is high. And so we did that. In almost every violent felony crime of violence that occurred and still occurs in our community, our office asks the court to hold people without bail. And that means that they're being held because they are a true public safety risk, not because they can't afford to buy their freedom. And again, we have to put on evidence to prove that our case is good. So we know quickly whether or not that person is being held based on good evidence or being held based on hearsay or a victim or a witness that we might not be able to find. So we're doing that in all of those cases, and we continue to do that. And violent crime is down significantly since that 2022 year, and it's gone down each year. We collaborated.
Gone down each year.
Yeah. I've collaborated really closely with the UVM Medical Center, specifically the ED nurses, to have better lines of communications. We've brought law enforcement in so that we're all on the same page about how those cases should be handled. They all get assigned to me when they do come in, and those have dropped by over 50%. I think we have 2 currently pending. So they are feeling much better about their workplace violence. There's still work to do. I think their administration still has some work to do as well, but we've made significant progress on that. And domestic violence also went up during COVID. I think a lot of victims were trapped, frankly, and didn't feel comfortable calling police because of social distancing and an inability to stay with a friend or to stay at a shelter. And so by the time COVID sort of broke, violence had escalated significantly with no responses. So I actually hired a Burlington Police Department to come into our office and be a domestic violence investigator, now hired by us, employed by us. And her sole responsibility is to make those cases better immediately. So the day we get a case, she's involved.
Isn't she trauma
She's trauma informed, and she's specially trained in domestic violence investigations, which requires special training. They are complicated cases. They require a lot of compassion and understanding and patience to build trust with victims. And she does that, and we have seen a significant benefit in having her in our office and the strength of those cases, and therefore the outcomes of those cases for victims.
You know, thank you for that.
Yeah.
It's such a neglected population. And I've heard you mention, you know, compassion, understanding, trust, safety, repeatedly. And that to me is the key. Can you just talk for a brief moment about, because I think a lot of the viewing audience doesn't really understand harm reduction.
Yeah.
What, and when you say compassion, understanding, trust, safety, trauma informed, it makes me think of harm reduction. This whole idea of, you know, in any population, to extend a safe place where people feel comfortable being who they are, so relationship can develop, and we can begin from there. Can you talk a little bit about that?
Yeah, I mean, you said it. I think that harm reduction is not just about drugs. Harm reduction, from my perspective, is public safety, which means to me that you are meeting people where they're at, you are asking people where they're at and what they need, and you are listening to that, and you're giving them what they need in that moment in hopes that the next time they'll take a little bit more and a little bit more and a little bit more until they are in a place that they are ready, and they are in that place because they have had that control to get there. There is, you know, with domestic violence in particular, we see victims will report, and, you know, the person might be arrested, And the very next day, they are asked to make massive decisions about their future and the person that they love and their family and their financial circumstances and their housing circumstances under a lot of pressure. And when forced with that pressure, it is often easier for them to say, I don't want anything to do with this, I recant, I take it back, to avoid being at a 100. So we are trying to find ways through using our domestic violence investigator to not put so much pressure on them so quickly, to build that trust, to make sure they know that we are a safe place for them to have these conversations and we will listen to what they want. So that's harm reduction in that sense. And then with drug use, there's a lot of talk about forcing people to stop using drugs, force them into treatment, and or they'll have to go to jail. When the evidence is so clear that forced treatment has significantly less likelihood of success, people are more likely to relapse, in, like you said, relapse in ways that are more fatal, because they might go back to using the same amount when they get out of jail, despite having lost some tolerance. So meeting people where they're at and allowing them to say when they're ready doesn't mean there can't be some consequences in between. You have to acknowledge the likelihood of success in those consequences. And addiction literally is the brain knowing that there are consequences for what they're doing and being unable to adjust to that. And so this idea that consequences are going to fix it, the brain science actually directly refutes. And so just trying to find ways to meet people and to bring them to you when they're ready.
Yeah, everything you say reflects a deep understanding of what we're talking about, and I appreciate that.
And we've seen that now that we have people coming in every Friday, we see the difference in people's readiness, even just from week to week. Someone who comes in the first week and is angry that they're there might be feeling like a target or feeling like they're in trouble, which they are, but over the weeks they build trust with Kim, the caseworker who's present. They build trust with me or with the court, their attorney, and they see the progress and they start to make those decisions on their own. And when that happens, they come in and are so proud of what they have accomplished on their timeline and their abilities that it is more likely to be successful in the end.
Yeah. And that idea of that being the fruit of a relationship that was important enough to develop over time. You don't begin there, and you need patience, and you need understanding, and you need acceptance and safety to build that relationship. Having that kind of faith in human nature, that willingness to invest time and resources in that person, they feel that. They may not know what it is because it may be foreign, but they feel it, and that's an incentive to come back. And I really appreciate that work.
We've had some of our most sort of stubborn folks that have gone through this court on Fridays and have come in and said to me, Sarah, I will not let you down. And I imagine I'm probably the first prosecutor that they've said that to. But I think it builds trust with our entire system when they see a prosecutor who cares about their well-being long term and not just about punishing them.
And it's just, who cares? That word, cares. It's almost become meaningless. But when you say it, it's so meaningful. It means so much. It's so important. And when you investigate what it means, it just has all these beautiful branches that embrace people who are accustomed to being shunned and punished and having backs literally turned on them. It's a whole different experience. I wanna end the show today with something in particular. You've been in this position for 8 years, and you're attempting to be in this position for another 4 years. Now, this morning I was sitting on my porch, I was thinking about our interview, and hope, the concept of hope came to me thinking of you, hope. And I realized that while I'm feeling hope, and it's a beautiful feeling, hope is not a feeling. Hope is a plan. Hope is a plan. And I want to hear, what is your plan? With 8 years behind you and 4 years likely in front of you, what is your plan? Well, you know, what is our hope with Sarah George?
Yeah. You know, I feel like we have made so much progress over the last 4 years in particular, building relationships in our community, building the sort of breathing room within our courthouse that we needed to prioritize a lot of the cases that were most impacting our community, a lot of the sort of repeat offenses. I want to build on that. I want to make sure that we continue the funding for a caseworker in our courthouse. I actually want to advocate for it statewide. I think every courthouse in our state should have a caseworker available all the time to meet with folks. I want to advocate for more housing, which, you know, is not something I can do, but I can certainly continue to advocate for it. And I really want to build on, you know, we're starting to centralize our restorative justice practices in Chittenden County. And I really want to build out our ability to send cases, a lot of cases through restorative justice. They, you know, victims are 88% more likely to be satisfied with the outcome of a case that goes through restorative justice rather than our current legal system. And I want to make sure that victims' voices are truly heard and that their harm is truly repaired in a way that our legal system does not allow for. So I think that continuing to work with law enforcement to build those things out, working with the state or the legislature, or maybe even through Howard Center to fund having a caseworker within our courthouse, to make sure that our, you know, as our judges change, the judge who is doing that particular Friday court continues to have what we need, the compassion and the understanding of addiction that we need to make those cases successful. And again, continuing to work with both the UVM Medical Center, or really anywhere with workplace violence. You know, our social services deal with workplace violence, and I think we need to figure out a way to make sure that they are protected in the important work that they're doing. And just generally continuing to talk to the community about the sort of inefficiency and ineffectiveness of the historical way that our legal system has worked, and to find new and innovative ways to create true public safety that is not based on your wealth, is not based on your race, and is not based on your documentation to be one of our community members. And it's a big task, but I think we've made incredible progress, and I'm excited to keep pushing for that.
Thank you.
Yeah.
Thank you.
Thanks for having me.
Yeah, I'll just say in the closing to the viewing audience that there you have it, Sarah George. You know this quote about the arc of the moral universe is long, and I might add bends slowly.
Yeah.
But I think without people like you, it would not bend at all, so thank you.
Thank you. I appreciate that, Ed.